So, thank you for joining this year's debrief on the annual Professional Issues Self-Assessment we call PISA. I'm Fiona. I'm one of the advisors at the college.
Hi, everyone. I'm Mary Catherine, and I'm also one of the advisors at the college. This year's PISA focused on two key aspects of our practice, privacy and patient safety. Thank you for completing the exercise. We hope you had the opportunity to reflect on your practice and review some of the information and resources on the college website. Generally, physiotherapists got the majority of questions right, but there were a few questions that may have been a bit tricky.
So, we reviewed the collective data to identify those questions that might need more clarification or education. We'll go through these questions together. Let's start with privacy. In Ontario, privacy is a fundamental right, especially concerning personal health information. The Personal Health Information Protection Act, we call PIPA, guides us on how to collect, to use, to disclose or share this information. And as PTs, it's important to understand and follow these guidelines. Based on the responses we've identified, areas where additional support might be helpful. We'll go through some key questions that highlight these areas. The first question we're going to share relates to a person or an organisation who must take responsibility for the custody or the control of personal health information. So we ask this question: does every facility, clinic or organisation or solo practice that collects personal health information from patients need a person designated as the health information custodian or custodian, we'll call?
So the answer is yes. Every organization must have a health information custodian. Some examples of the health information custodian, or we'll refer to them as custodian during the presentation today, includes healthcare practitioners such as physiotherapists, clinic owners, community care access corporations, hospitals, and long-term care homes. The role of the custodian is critical in ensuring the protection and confidentiality of your patient's records. If you are a physiotherapist practicing independently, for example, you have your own home care business, you are the custodian for your patient's physiotherapy records. As the custodian, you must have safeguards in place that will be technical, physical, and administrative in nature to protect the patient's charts. A privacy policy should detail what those safeguards are. If you work within a practice, such as a hospital or community care organization, you are likely not the custodian. You are considered as an agent of the custodian. This means that you must understand and be able to apply your facility's privacy policy and procedures. Always contact the custodian with any questions you have about privacy within your organization, or as for example, as who can access patient charts, who can get a copy of a chart, and importantly, the procedures to follow in case of a privacy breach. Fiona?
So we just talked about the responsibilities of the person or the team responsible for the information in the patient's chart, or as we've been calling, the custodian. But what about an agent of the custodian? An agent is a physiotherapist, in this case, authorised by the custodian to collect patient information and access the patient's charts in order to provide services. So how do the responsibilities differ? The PISA included a question about the responsibilities of an agent related to containing a privacy breach. The question featured a physiotherapist who worked for a home care company and unfortunately left a couple of patient files at a local coffee shop when they visited between appointments. The physiotherapist tried to retrieve the files the next morning, but they were gone. We asked you about the physiotherapist's responsibilities as an agent of the custodian. Several people did understand that an agent acts under the authorization of the custodian and must follow their privacy rules and policies, but there was still some confusion about the difference between the two roles. So let's get into that.
Great. So in the event of a breach, the correct answers were A, B, and C, all of them. Some physiotherapists answered either A or B or C, but those were really only partially correct. Primary point is that the custodian should have a privacy breach protocol that the physiotherapist needs to follow. Once reasonable attempts have been made to get the files back, the PT must follow coordinated steps to manage the privacy breach, but it is not the agent's job to contact patients. It is the custodian's job. It's their duty to notify the patients, and this must be done at the first reasonable opportunity. We also asked a question about the purpose of a privacy policy. So this question featured Naveen, a physiotherapist who just bought a physiotherapy clinic and hired 3 physiotherapists. As the clinic owner, Naveen is the health information custodian responsible for the patient's charts. According to the PISA, the custodian controls access and safeguards the personal health information. So, as the custodian, Naveen needs to develop a privacy policy for the clinic and share it with other physiotherapists.
So we asked, some physiotherapists were unsure of the purpose of a privacy policy and answered either A or C, but the correct answer is actually B.
That's right. The purpose of the privacy policy should clearly outline how personal health information will be collected, used, stored, and protected within the clinic. The policy should include steps to help maintain the confidentiality and security of patient information and rules about who the information can be shared with. A well-crafted privacy policy also informs patients about their rights regarding their health information. This policy is crucial in building trust with patients, ensuring they feel safe and have confidence in the care they're receiving at the clinic. Physiotherapists at the clinic should know that there is a privacy policy and be made aware of the processes they would need to follow. We have a resource for you on our website that can help you write and develop a privacy policy. It can be found under the Privacy Resources tab, but you can always contact us if you're having trouble locating it. Fiona, over to you.
Well, the next question we'll look at focuses on confidentiality and understanding who can view a patient's information. And I'm glad to say most physios got this one correct. It's so important. It carries such risk to the ongoing trust we build with the public, we build with patients. There have been some troubling stories in the newspapers and the media about other healthcare professionals accessing information when they shouldn't. This is known as snooping. Some people did get this question wrong as well, so we wanted to reiterate some key points. The question we asked, if a physiotherapist working in a hospital could check their father's medical charts to review results of tests. The physiotherapist did not provide physiotherapy treatment to their father, but they thought it would be okay to review the information since it was a family member. MC?
Well, the answer here, of course, is no. It makes no difference if the patient was the physiotherapist's father. The physiotherapist cannot access this information. The key points to remember here are that only healthcare providers directly involved in a patient's care can access their information. This is known as the circle of care. And even family members need to get the patient's consent to access any health information. Accessing health information without proper authorization is called snooping, as Fiona mentioned, and it's not permitted regardless of intentions. There are some pretty serious consequences to snooping that may include legal and regulatory action, including loss of employment and definitely erosion of patient trust. So it's really important that physiotherapists understand the privacy laws and respect patient confidentiality. Unfortunately, the college has received complaints about physiotherapists who accessed patient information without the proper authority and who were not involved in the patient's care.
So the next question is about accessing patient information after a physiotherapist has left their practice. And Marco is a physiotherapist who is leaving their current job to work at a different clinic. Marco would like to contact all current and former patients to let them know their new clinic address. Marco plans to use the contact information in the patient's files, including email addresses and cell phone numbers. Is it appropriate and safe for Marco to contact patients using the information listed in the patient's charts?
Well, here again, the answer is no. Marco must not access or use a patient's personal health and contact information without the authority of the health information custodian, or that custodian that we spoke of earlier, including express consent from the patient. This question raised some concerns for us, as many people thought that it might be appropriate for Marco to use the contact information in the files to contact patients if ongoing treatment was clinically indicated. This is not the case. This answer does not consider the need for explicit consent from the patient or authorization from the custodian before using the personal health information. So remember, it's the custodian that handles the management and control of patient information, and any use of this information must be approved by them. Remember, when leaving a practice, we recommend having a conversation with the clinic owner about how you might message to patients about your departure and your new location. As patients do have the right to choose who provides their care, we suggest informing the patient that your employment information can be found on the college's public register. If a patient chooses to follow a physiotherapist to their new location, the patient can request a copy of their physiotherapy record, but the original record should remain with the original organization. This year's PISA included 2 questions about charging fees to retrieve information. The first question asked, can a fee be charged to an insurance company for a list of the patient's appointments and services provided? Many people answered this incorrectly and thought it might be okay to charge the insurance company a fee of any reasonable amount, like $20 or $30, for example. The correct answer is that no fee can be charged to the insurance company to provide a list of the patient's appointments and services provided. According to the Fees, Billing, and Accounts Standard, physiotherapists must provide an itemized account for services and/or products if the patient or a payer requests one, and it must be provided free of charge. As a reminder, it's not always necessary to request a copy of a patient's signed consent form to share this information with the insurer. Most patients will have already signed a consent form as a condition of receiving insurance benefits. If you or the patient are unsure if they've provided this type of consent, you can ask for confirmation from the insurer.
So we had a second question, and we asked if PTs can charge a fee to photocopy a patient's clinical record. Almost 2,000 physiotherapists thought they couldn't charge any fee. But the correct answer is actually yes. A PT can charge a reasonable fee to photocopy a patient's record. According to the Information Privacy Commissioner of Ontario, a reasonable fee for providing access to health records is based on the concept of reasonable cost recovery. Specifically, the Information Privacy Commissioner suggests a standard fee of $30 for photocopying or printing the first 20 pages of a record, with an additional charge of 25 cents per additional page. Remember, the fee must be clearly communicated to the patient, published at the clinic or online, and an estimate should be provided before the service is rendered. This ensures there's transparency and allows the patient to consent to the cost beforehand. So next we have a question related to the use of social media and privacy. Many physiotherapists or clinics are now have an online presence, which is a great way of sharing information about your services, but privacy should always be top of mind. In this question, a physiotherapist decided to feature an athlete on their clinic's Instagram account. The athlete was attending physiotherapy to help with a shoulder injury. The Instagram post included a description of the injury, a brief interview with the athlete about the recovery process. The athlete believed the reason they were not selected to play at professional level that season was because a recruiter saw the post on Instagram. The athlete was obviously angry and complained to the college that their privacy had been violated. So I'm saying, can a physiotherapist feature a patient on social media? If so, what are the legal and the ethical responsibilities the physiotherapist must consider?
Well, there was a range of answers to this question, which highlights to us that social media and privacy are still evolving spaces with a mixed understanding. Interestingly, many people said no, a physiotherapist can never use a patient in a social media post, while several others thought that it might be okay if the post was for educational purposes. However, the correct answer was D, that yes, a physiotherapist could feature a patient on social media, but there are certain professional obligations that must be met before this can happen. Notably, a physiotherapist who wants to post using patient health information must first communicate with the patient about the risks of sharing their personal health information online, and the physiotherapist must get the patient's consent. The process of getting consent is more than just a patient signing a form. Before posting any patient information online, you need to talk to your patient about the risks and benefits, make sure they understand them, and give your patients a chance to ask you questions. There are some key risks you should make your patient aware of. The first is that once information is posted online, it might become permanent. Even if you, as the poster, delete it, others could have taken screenshots or saved copies, making it impossible to fully control who will see the content and how it will be shared. When interacting with your patients, be aware of the power imbalance in your relationship. Patients might feel pressured to agree to your requests to participate in online posts because they see you as an authority figure. Always prioritize your patient's best interests and consider their vulnerabilities, such as their need for ongoing physiotherapy care. Make it clear to them that they can refuse any request and ensure they feel comfortable doing so. Remember, no consent, no posting. If the patient doesn't give consent, you cannot post the information online, even if it's for educational purposes.
Okay, moving on to the second topic that was covered in this year's PISA, patient safety. As a reminder, all patients have the right to receive safe physiotherapy care. Physiotherapists are responsible for ensuring the physical and the emotional well-being of patients throughout their treatment. So we had two questions that we wanted to highlight to help reiterate some points, some key points about patient safety. The first question involved a physiotherapy resident and the controlled act of acupuncture. We receive a lot of questions about performing acupuncture, who can perform it, and the safety considerations. In this question, we asked, Adriana is a physiotherapy resident who works in a busy outpatient clinic with 3 physiotherapy assistants. Adriana is newly rostered to perform acupuncture. What are some of the things that Adriana should consider before performing acupuncture on patients? Many people believed that the supervisor needed to be in the same room to oversee Adriana and the treatment she was providing, and some said there were no considerations for Adriana. Unfortunately, these are both incorrect. The supervisor does not need to be in the same room as the physiotherapy resident all of the time, and it depends on the circumstances kind of answer. The level of supervision is really determined by the supervisor, and it's based on the patient's needs, their risks, while considering the knowledge, the skill, and the judgment of the physiotherapy resident. So maybe there are times it's a good idea for the supervisor to be on site with the PT resident. It's not always required. In some cases, it'll be appropriate for the PT resident to be alone with the patient. So as a reminder, acupuncture is a controlled act that carries certain risks. Even though Adriana is rostered to perform acupuncture, that doesn't mean there aren't specific considerations for each patient. The considerations include having a written plan for managing adverse events, self-assess whether Adriana has the proper training to perform acupuncture for this patient, and the supervising physiotherapist always being rostered for acupuncture. Make sure Adriana's insurance is also up to date. MC.
Okay, so on to the final question that we'd like to discuss today. This one relates to helping patients to feel safe in their physiotherapy session. We thought this question carried such high risk for patients, we wanted to discuss it here. The question comes up a lot, and several people also answered this one incorrectly. While the PISA question specifically mentioned pelvic health care, this question is applicable to all physiotherapists who provide treatment in private rooms, as you may not know the patient's history of trauma or what makes them feel uncomfortable. The options of answers for the question as to whether you should close the door to help patients feel safe in their physiotherapy session were A, always, B, never, or C, under certain conditions. And the answer is C, under certain conditions. There are some risks of closing the door during a physiotherapy session. Some patients may feel anxious or uncomfortable if the door is closed, especially if they have a history of trauma or feel claustrophobic. While we understand that physiotherapists often have good intentions when making a decision to close the door, making an assumption about the patient's preference limits their autonomy. Closing the door could also be misinterpreted by the patient. The patient may not feel comfortable expressing their needs or concerns with the door closed, leading to a breakdown in communication. Always ask the patient about their preference and ensure they feel safe and comfortable with the decision. This is particularly important at the initial appointment. Consider the power imbalance inherent in the healthcare appointment, and consider the importance of patient safety when first establishing the therapeutic alliance.
Okay, thank you for all of you for taking the time to watch this webinar. We really hope you've gained valuable insights and that we were able to clear up some common misunderstandings from this year's PISA exercise. We really hope that you take some time to contact the Practice Advice team if you have further questions about privacy, about patient safety, or any practice issues. And we're really happy to chat with you and work through your questions. You can contact us by email at advice@collegept.org or by calling 1-800-583-5885 extension 241. Thank you.
Thank you.